Hello, this is Leonel Sabaya. Today I'm going to perform nasopharyngeal suctioning. This is performed to remove secretion from trachea when a patient is unable to clear them independently. For an adult suction, the mouth first, then proceed to nose. This is done for aesthetic reason. Here's the equipment that we're going to use for the procedure. We have wall suction or portable suction unit, a connecting tubing, sterilized normal saline solution, disposable sterilized container, sterilized suction catheter number 16, a French for an adult, sterilized gloves, clean gloves, goggles, overbent table, waterproof trash bag, and the towel. Good morning. My name is Leo. I'm your caregiver today. Can you please state your name and birthday? Can I check your resume? Today we're going to perform nasopharyngeal suctioning. So suctioning may stimulate transient coughing or gagging, but it helps to mobilize secretion. Is that okay? Okay, let's start. Wash your hands. Hand washing reduces transfer of microorganisms. Close windows and doors to provide clients privacy. Gather and place the suction equipment under the client's overhead table or bedside stand. Position the table or stand on your preferred side of the bed to facilitate suctioning. Connect the tubing to the suction unit. Date and open the bottle of normal saline solution. Open the waterproof trash bag. Turn on the suction from the wall or portable unit and set the pressure according to your facility's policy. The pressure may set between 100 to 150 millimeters of mercury. Include the end of the connecting tubing to check suction pressure. Tube occlusion test suction apparatus. High pressures cause excessive trauma without enhancing secretion removal. Place the client on semi-Fowler's or high Fowler's positions, if tolerated, to promote lung expansion and effective coughing. If the client is unconscious, position the client on his side facing you to help promote drainage of secretions. Side placement promotes forward drainage of secretions. Place a towel across the client's chest. Towel prevents contact with secretions. Using strict aseptic technique, open the suction catheter kit or the packages containing the sterile catheter, container, and gloves. Don the gloves, considering your dominant hand sterile and your non-dominant hand non-sterile. Using your non-dominant hand, pour the saline solution into the sterile container. Pick up the catheter with your dominant, sterile hand and attach it to the connecting tubing. Use your non-dominant hand to control the suction valve while your dominant hand manipulates the catheter. Lubricant 3 to 4 inch of catheter tip with irrigating solution. Lubrication prevents mucosal trauma while the catheter is inserted. The measurement of depth from tip of the nose to the tip of the earlobe. Instruct the client to cough and breathe slowly and deeply several times before beginning suction. Coughing helps loses secretions and may decrease amount of suction necessarily, while deep breathing helps minimize or prevent hypoxia. Raise the tip of the client's nose with your non-dominant hand to strengthen the passageway and facilitate insertion of the catheter. Without applying suction, gently insert the suction catheter into client's nares. Roll the catheter between your fingers to help it advance through the turbinates. Continue to advance the catheter approximately 5 to 6 inches or 12.7 to 15 cm until reach the full secretion of the clients begin to cough. Using intermittent suction, withdraw the catheter from the nose with a conscious rotating motion to minimize and vagination of the mucosa into the catheter tip inside ports. Apply suction for only 10 to 15 seconds at a time to minimize tissue trauma. Between passes, wrap catheter around your dominant sterile hand to prevent contamination and clear the lumen of the catheter by dipping it in water and applying suction. Repeat the procedure up to 3 times until gargling or bubbling sound stops and respiration are quiet. Allow 30 seconds to 1 minute to allow reoxygenation or reventilation. After completing suctioning, pull your sterile gloves off over the cold catheter and discard it in the non-sterile gloves along with container of water. Glove removal reduces transfer of microorganisms. Discard the used items and replace with the new supplies so they will ready for the next suctioning. Having the supplies at the bedside facilities a quick responses. Remove personal protective equipment and wash your hands. Hand washing reduces transfer of microorganisms. Let the client rest after suctioning while continuing to observe. The frequency and duration of suctioning depends on the client's tolerance for the procedure and on any complication. Record the date, time, reason for suctioning, and technique used, amount, color, consistency, and odor of the secretion. The client's respiration status before and after the procedure, any complication and the nursing action taken, and the client's tolerance for the procedure.